Zensa is an intelligent, wearable, non-invasive wireless device that facilitates the sensing and transmitting of 3-lead ECG traces, heart rate, respiration rate and motion, with alerts sent when arrhythmias or rate breaches are detected by the onboard algorithms. Zensa detects 6 arrhythmias, such as tachycardia, bradycardia and atrial fibrillation, which can be a precursor to stroke. Offering 7-day full ECG and respiration disclosure and cardiac event monitoring and transmission, the innovative lightweight device is easily configured, allowing clinicians to set parameters that best suit the patient's needs, such as high and low heart and respiration rate. With patented stick-and-click disposable electrodes that reduce motion artifact, patients can easily apply fresh, shower-proof patches to extend the monitoring period if required. Once fitted with the Click-On CE Class 2A device, detected arrhythmias and rate breaches are transmitted over standard Wi-Fi, with all vital signs monitored and recorded 24/7 as they continue with their everyday routine. The patient's regular daily activities can continue with full peace of mind that the onboard algorithms will detect and immediately transmit all detected arrhythmias or rate breaches from the convenience and comfort of their own home or workplace for faster diagnosis by their doctor. The patient can also activate the transmission of a trace with a simple press of the button. All events are transmitted to the online server for review by their clinician. Powered by rechargeable batteries, Zensa will continuously monitor all vital signs. The patient can continue to move freely, with the device discreetly and automatically transmitting any captured events as they occur. For clinicians, the ability to access and review patients' vital signs remotely at any time allows for more efficient time management. With 7-day full disclosure of data having been recorded on the device memory, all recorded data can be easily accessed, downloaded, and if necessary, converted to a PDF format report.
Here are some of the features of the Lola Personal Locator device. Lola allows the person instant connection to a predetermined telephone number automatically and sends a text message to his designated recipient at the touch of a button.
I have no idea where I am right now. I'm completely lost.
Okay, stay where you are. We can locate you.
The panic alert button instantly opens two-way communication, and even if the holder of Lola cannot speak, the alarm will be sounded and the Location Now database will pinpoint the location of the emergency. If contact with a loved one by regular methods has failed, you can call Lola and the device will vibrate to alert the holder. If there is still no response, two-way communication can be initiated for direct contact, and Location Now will identify exactly where the person is located. If you fall or have an incident of sudden impact while wearing Lola, a built-in accelerometer sensor will send an instant alert when a G-force of 1 to 5 has been detected. Both two-way communication and instant location will then be established. Lola excels in any situation that involves isolation of an individual and where assistance is not readily available, such as for the constant care of seniors with cognitive, mobility, or health issues, the recipient of Lola is given a measure of independence and security at the same time, knowing Lola is watching over them. Caregivers have peace of mind in knowing that at a moment's notice, they can be in direct contact with their loved ones. For the monitoring of activities of children with autism and other physical or emotional challenges, Lola brings security and peace of mind to guardians and parents. For individuals who regularly find themselves in remote situations, in working and recreational environments where contact is limited, you are never out of contact when you are connected with Lola. For the security of students at college and university, our learning institutions have installed safety measures such as blue lights and text messaging and even 911 on campus, but these measures are generally after-the-fact responses. Lola sends an instant alert to campus security and pinpoints the exact location of the emergency. Contact us for more information on how Lola can give you peace of mind for the safety and security of your loved ones.
Today I'm representing NHS Dorset, NHS Bournemouth and Poole on the telehealth project. The advantages of the telehealth project to this NHS cluster is the opportunity for patients to self-manage their own conditions and thereby reduce their call on emergency services and hospital admissions.
It saves doctors time because patients are managed better on a daily basis through a telehealth system. And therefore the need to contact that doctor when things are going wrong reduces. The patients have a facility at home. It's a bit like a small iTablet. On a daily basis they input a mix of clinical signs and symptoms, which is then fed up the line. It is then processed securely, and then a specialist nurse, it's usually a specialist nurse, can then look at the patient's results every day, come to the conclusion they're fine, or they need a little bit of advice, or they need a lot of advice, or they need to do something that day so that we can preempt them getting into trouble.
Having my ability to be able to monitor them more closely, that's how they see it, that they'll be able to put in their readings each day, and they know I will be able to look on my computer and see the readings, and if there are any concerns I will then be able to phone them, either talk them through the situation or make a home visit appropriately.
With the telehealth equipment, for people of any age and any condition, it gives them a reassurance that somebody is keeping an eye on them, somebody is out there watching to see that they're okay. They're given self-management techniques themselves, but it also provides the opportunity for them to learn their own condition and to know that somebody's watching out for them.
Yes, patients get a lot of training. They get as much training as they need to be able to use the electronic kit, which is not that difficult. I have experience of 2 years ago in 100 patients, mostly very elderly, some quite frail, who were actually using electronic devices then, and the devices that we're now able to give them at their home are much superior. They're easier to use. Touch screen, large screens,